come forward, particularly if ACT Health have contacted you and you are a close contact or you have been at one of the exposure sites. This really, really high level of testing is such an important surveillance tool for the ACT. Now, quite a lot has happened in the last 24 hours. Yesterday afternoon, the New South Wales government announced a lockdown for the entire state of New South Wales. This obviously has significant implications in the Canberra region, and it does really align the situation in terms of what people need to do right across the Greater Canberra region. So the message is very simple: please stay at home. The only way the virus spreads is when people come into contact with each other. So if you're watching this on the other side of the ACT border and you're in the Canberra region, there are a small number of essential reasons why you could travel into the ACT. But right now, the best thing for everyone to do is to stay at home. We welcome the announcement from the New South Wales government that there will be this statewide lockdown. That gives us an extra layer of protection, whether you're on the ACT or New South Wales side of the border in the Canberra region, that everyone is in the same situation now. Staying at home as much as possible is the best protection that we can give each other, and an important next level of cooperation between the ACT and New South Wales. We are aware of the challenges that the cross-border situation presents, and we're working with our New South Wales counterparts to make it as straightforward as possible. But the simple message, unless you absolutely have to travel, unless you absolutely need to leave home, don't right at the moment. Now, the other breaking news this morning is the Prime Minister's announcement of the additional 1 million Pfizer doses. I found out about this just a few moments before it was made public, but it's a welcome announcement. What it means for the ACT is about an additional 14,000 Pfizer doses. Now, they need to be batch tested by the TGA before they will become available, so they're not available tonight or tomorrow. They've got to get into the country. But we are anticipating that they will be available to us later in the week. Now, this is important. It's a welcome boost to supply. But to put it in perspective, it's roughly the equivalent of 1 week's worth of additional doses for what we would do in our ACT government clinics. So it will allow us to do more, but it is not such a dramatic increase in supply that it will allow us to do radically more. We're working on what this will mean, and we'll have some further information for the community in the coming days. But we only found out about this a few minutes before the rest of the nation, so we'll just need a little bit of time to work through that, and we'll provide an update for the community on what these extra doses will allow in the coming days. So look, finally, thank you to Canberrans who've been doing the right thing. It's been so pleasing to see the seriousness in which Canberrans are responding to the challenge that we have. I understand people are concerned and anxious. It's a challenging time for everyone. But the response from the Canberra community has been fantastic. Please keep doing what you're doing, staying at home, supporting each other, and if you've got any symptoms or you've been identified as a close contact, coming forward to be tested. Thank you very much. We'll continue to update the community several times a day on the COVID-19 website, and again each day through press conferences like these. I'll now invite Dr. Coleman to provide some further information for the community on the latest cases and exposure sites. Dr. Coleman.
Good morning, everyone, and thank you, Chief Minister. As he indicated, my name's Karen Coleman. I'm the ACT Chief's Health Officer, and I'll just confirm, since our previous update yesterday, we have recorded 2 new COVID-19 cases. So this does bring us to a total number of 9 active cases in the Canberra community. The good news is that at this stage, none of those cases are hospitalised, and all active cases are appropriately isolating, being supported by ACT Health, and we're monitoring them closely, both from a health and general wellbeing perspective as well as a compliance perspective. We continue to work with approximately 5,700 people who have self-identified to us as close contacts. So to provide some further details about the new cases, some of which the Chief has already discussed. So the first new case is a man in his 20s. And while we have no obvious links at this point in time, it is early in the investigation, and those investigations and case interviews continue. The second new case for today is a man in his 20s. Early investigations are indicating that this person may have attended one of the known close contact exposure locations, the Fiction nightclub, from 1 a.m. to 4 a.m. on the 8th of August. Case interviews and contact tracing is continuing with all of our cases. But I do like to remind you all, it gives me the opportunity with the Fiction nightclub in particular. So if you are a close or casual contact, please take this seriously and follow the public health advice. This demonstrates a possible transmission in an exposure site. So we aren't doing this for fun, this is really serious. With the new cases, the number of close and contact exposure locations has also grown. The number of venues is now over 40. And we are seeing venues in the Woden area impacted. So if you live or work in these areas, it's now important to check to see if you've been to affected location. So these exposure locations will now start to impact on different areas of the territory. So we started seeing them in the north and the city, and then as we identify more cases, they will move around the territory, as I've just discussed, into the Woden region here. All the details are on the ACT COVID-19 website, and we'll have another refreshed exposure location update early this afternoon. And I do understand there are quite a few new locations to go on at the next refresher, so please keep an eye out for that. Just a reminder, if you have been to a COVID-19 close or casual exposure location at the specific time listed, it's really important you complete our online declaration form. And just to note, we are receiving quite a lot of declaration forms, which is fabulous, and everyone's doing the right thing, and we are working through these. But please don't wait to hear from us. This is a good record for us to have, but make sure that you do what we're asking you to do. Get tested and isolate straight away. Follow the public health advice. Don't wait for us to get in touch with you. And just a reminder, if you are going to get tested, please don't go anywhere else. Please go straight to get tested and come home. Don't stop at the shops. Don't go to the library. Please remain in quarantine. And just finally, a big thanks to ACT Policing, who are continuing to conduct our border and compliance checks to assist in enforcing these public health directions to help keep us all safe. Police do tell me that they are seeing a number of people who are forgetting to wear their mask in public. Please remember to wear your mask in public, particularly if you're in groups of people or you inadvertently come into contact with someone. But that's all I have to say at the moment, so thank you, and we're happy to take questions. I'll stay first.
Jasper.
Chief Minister, we've heard that there could be a potential impact on the ACT's vaccination rollout if testing demand remains very high. Is the ACT looking at cancelling already booked vaccination appointments to meet that testing demand?
No, I'm very clear on this point that vaccination is very, very important. Yes, it is. This is one of the workforce challenges that we are balancing here. But we've been able to surge up our testing capacity across the territory in partnership with private pathology as well to get to nearly 6,000 tests yesterday. So put that in perspective, that's the equivalent of New South Wales conducting 125,000 tests in a day. So that's it's a very big number for a jurisdiction of our size. Population 430,000, that's getting towards the 1.5% of the total population coming off the back of the day before that was more than 1% of the total population. So the cumulative number of tests since we went into lockdown is significant now, and getting continuing obviously with testing today.
What's the maximum number of tests that the ACT can collect each day, and what's the maximum number that can be processed?
Well, look, I think there's depends obviously on the efficiency and throughput of each of the testing centres. But as I mentioned yesterday, we were able to improve the efficiency of Exhibition Park, to be getting to one test every 30 seconds. The additional capacity that we've stood up has seen us get near 6,000 in a day, so that's a pretty good indicative range. Our labs have the capacity to churn through thousands and thousands of tests every day. Part of the issue, of course, is just the distribution of tests from testing centres into labs, and so we're working them 24 hours a day, and I'm advised that we're not under testing capacity pressure in terms of assessing each of the tests at this point in time.
For the Chief Health Officer.
Hasn't been asked yet.
Have we been able to link the Gold Creek student case to anyone yet, or is that still under investigation?
Yeah, that's still under investigation. We now have 9 cases, and that gives us some really good, rich information. I know it's not a good outcome, but it does give us some really good, rich information in which to investigate this outbreak. So we're continuing to look at where the linkages and the crossovers are occurring and how this is spreading within the ACT. So the short answer is no.
And have we found patient 0? Is that original case, has that been linked directly to Sydney, or are we still suspecting that there could be a middle case we haven't found yet?
Yeah, you're absolutely correct. Part of that ongoing investigation is looking at all of those potential linkages, and we still haven't nailed that one either.
Chief Health Officer, is the message still the same for people wanting to get a test? Is it still close contacts and people who are having symptoms?
Anyone who's been identified as either a close or a casual contact, please follow the advice on the website, which is specific for your category of exposure, and also people who currently have symptoms. That is our key priority, and that's the best way we're going to be able to identify how far the initial spread of this virus is in the community, and therefore how far and how long we might have to be managing this for.
What would it mean for lockdown if we can't find this missing case or this source of original infection? Does that have any implications about what would be announced in the next few days if we're able to adequately pick up more cases or lock people down?
It's certainly one of the important aspects to the consideration, but I think the second important aspect is our degree of testing in the community and our ability to feel confident that if there were other cases in there, that we would have picked them up. So a number of different factors get taken into consideration, and in some cases investigations into clusters and outbreaks haven't actually been able to specifically identify where and how the introduction or seeding occurred, but we get to the point where we're confident that those chains of transmission have petered out, we've got them under control, and the ongoing risk is limited.
Given the high testing numbers we have experienced over the last few days, and at the start I think you mentioned that the first man was a prolific user of the check-in app, and we got most of the data from there. How concerning is it that we haven't been able to pick anything up this 3-4 days later?
Oh, look, I think our investigation has picked up some really good information. I've actually been involved in several public health investigations, and I think we're well on track in terms of what we would expect to be having a look at and what we're seeing at the moment. So I'm really comfortable with where we're at in our investigation.
Do these number of cases and tests give you optimism that lockdown could end on Thursday?
Oh, look, as I think I've said before, I'm making no promises at the moment. I do think people need to be realistic. We know that 14 days is the maximum incubation period that we work to, and if there is an infectious case in the period in that period of time, I've previously discussed the need that is our risk period time. So I think we need to be realistic. We have not made a decision yet. As Chief talked about yesterday, I think it was, that we are going to get as much information as we can to make the best possible evidence-based decision prior to Thursday next week.
Can you provide a bit of an update on wastewater, Are there potential areas that are more concerning than others?
So we're currently doing twice weekly wastewater testing. So the next one since the one that flagged, or popped as we sometimes call it, is due back to us tomorrow. So I might have an update for you on that.
The exposure time at Fiction Nightclub has been extended back to 9 o'clock on Saturday night. Can you offer some explanation of what's prompted that extension and whether it's how concerning it is that people were potentially at the nightclub earlier than midnight have now been in the community for up to a week?
Oh, well, what's really good is everyone went into lockdown from the identified time. So there is no additional, people should almost be in quarantine and in lockdown anyway. Look, this is, I won't comment on the specific exposure site location, but this is what happens in public health. When we get different sources of information, we uncover, people remember, sometimes those exposure locations expand out, sometimes they contract down. There's a risk assessments that done, sometimes we elevate them up to a close contact, sometimes we pull them back down to a casual contact. So there's often this ongoing approach.
Can we please get a compliance update from the Chief Police Officer? Has any more border turnbacks been occurring?
So as of close of business yesterday or midnight last night, we had checked 140 businesses, hotels and other residences. Compliance is still very high. Between ourselves and the New South Wales Police, we pulled over in excess of 550 motor vehicles, including 350 on Lanyon Drive, which is the main thoroughfare between here and Queanbeyan and Jerrabomba primarily. Unfortunately, we did turn a number of cars away, including someone from Kiama who was attempting to get to the snow. That's been dealt with by New South Wales Police. And we also had a person from Queanbeyan who decided it was a good idea to just go for a bit of a drive. So clearly that's not on. I also ask people to be really careful when they go out and get takeaway coffees. Can you please get your coffee and then go somewhere else? Don't loiter around the location, and please make sure in public you're always wearing your mask or at least have one with you.
So how many people turned back in total?
4. So for a much smaller number than last time, so compliance is good. And I'd also like to thank our colleagues across the border in New South Wales Police. The cooperation on the border is great.
What are some of the penalties for breaking lockdown and also in particular for lying to contact tracers?
Certainly the fines are quite substantial in relation to people that breach quarantine and do the things that you've just suggested. And ultimately, if continued to cumulative breach, we can arrest people. I mean, ACT policing has taken an education posture throughout the pandemic. But I think obviously as things start to get more serious, we'll start to be a little bit firmer in relation to application of the law.
Sorry, just back to the Chief Health Officer, if that's okay. Are we able to get a specific update on the Gold Creek testing? We've got a pop-up site up there going through all the students and the close contacts there. Are we nearing that cohort, or when are we expected to finish that?
Yeah, so I don't have exact numbers for you. I'm really sorry. I just don't have them to hand. But I do know that the testing yesterday was amazing. We have a phased approach in that we're trying to go through the most likely year groups and people groups who have been exposed, putting them through first, and then progressively going down the track as we move along. So this will likely take us through till Monday and maybe even to Tuesday, but there is a plan. We're working through it with the community and it's going very well.
The transmission at Fiction, do we have any sort of idea or numbers about the amount of people in attendance or that may have been exposed through those declaration forms?
I don't have it on hand, I'm really sorry, but we could probably provide something along those lines.
Would you be able to clarify how many cases are from Gold Creek students?
So we definitely know that there is one case and then one close contact of that case who's positive. There are investigations ongoing for one or two others about whether there are possible links or not.
Is that case in the same household? Are you able to confirm that?
Oh, look, from an identification perspective, I'd prefer not to.
On the issue of testing, how long are people waiting for tests? Are most tests coming back within 24 hours? And sort of, can you give an update on the backlog to actually get results that have potentially been collected earlier?
So my understanding is that we're still meeting that 24-hour return timeframe. I'm happy to hear from people if that's a problem for them, but my understanding was that we're running pretty close to that still.
For the Chief Minister? The Prime Minister has indicated that the extra Pfizer doses going to New South Wales will be prioritised for younger people. We understand that you've only just got news of this. What's your initial reaction? Could you see the 14,000 in the ACT being prioritised for younger people?
It's just not enough to make any significant inroads in a cohort that's approaching 80,000 Canberrans. So to double dose, you'd need 160,000 doses. So 14,000 in 1 week isn't going to make the big inroads there. What it will do is bring forward our capacity in addition to the other scheduled supplies. So this is helpful, but it's not a game changer, I think is the point. And obviously they've allocated half of it into New South Wales. The difference, what that means, we would have, if it had been $1 million allocated per capita, $1 million doses allocated per capita, there's a treasurer speaking there, you would expect about 17,000 to have come to the ACT. We're getting 14,000, so even that 3,000 difference wouldn't have made a significant inroad. But what it does do, it's the equivalent, as I said in my opening remarks, of about a week's supply. So it's going to bring forward everything, but it's not the game changer that we need in terms of being able to open up vaccination to 70, 80,000 people aged between 20 and 29.
There's some growing concern that if New South Wales can't contain its outbreak back to 0 cases, that throws into doubt the ability for the whole country to reopen. Given the ACT is surrounded by New South Wales, could you see our current cross-border arrangements remaining in place longer than a Canberra lockdown?
Well, look, the New South Wales regional lockdown currently extends longer, over a longer time period than our proposed lockdown. The situation in New South Wales is very, very challenging, and yes, it does have implications for the nation, but it has very significant implications for the ACT. Part of the policy response from New South Wales will need to be, will they draw a distinction between Greater Sydney and regional New South Wales? Now, from what I've heard from their press conference earlier, they're undertaking Operation Stay at Home. Excellent idea, would have been even better about 7 weeks ago.
Chief Minister, we're hearing reports that the Check-in Canberra app is having some issues. People have told us that it's asking them to re-sign up and they've lost their list of where they've previously checked in at. Is that something the government is aware of?
Well, look, there was an update that I did say I updated it on my own phone, so we'll certainly have a look at that. I'm pleased people are still using it. Sometimes with apps and app updates, it helps if you turn your phone off and restart it, or occasionally to reload the app itself. But we'll get the technical team to have a look at that.
We've also heard reports that there are people from the ACT attempting to get tested in Queanbeyan because of shorter wait times. If positive results come back or any results come back from those tests, does that present a delay for ACT Health getting that information?
Yes, so there has been a little bit of facilitation across border in relation to a testing site at Seaford Oval, I understand. Look, it shouldn't. But obviously the two systems are talking to each other. I want to reassure people that ACT and New South Wales Health continue to be in close contact almost every hour on a range of these issues. So getting tested is the important thing, and we will obviously be sharing information. I can't be absolutely certain around turnaround times for those New South Wales testing sites, but I'm certainly not hearing of extended delays coming out of Queanbeyan testing sites at this point.
And is there any update on any conversations with Defence to provide support in Canberra on the border, clinical support, anything of that nature?
Look, we continue obviously to engage with the Commonwealth on these matters. There's a willingness to be supportive across Commonwealth Health, Defence. Everyone is working together. I can get some exact operational details, or the Minister for Health can, in fact, right now.
So yes, relatively breaking news. So Department of Defence is providing clinicians to support the testing at public clinics in the ACT. So 16 staff will be deployed by ACT Health to testing clinics across the ACT as required from tomorrow morning. So those staff will be deployed through ACT Health, and they'll be embedded within Canberra Health Services clinical teams to assist in the testing outcome. So I really thank you to the Commonwealth and Defence for responding so quickly to that request.
And is there any update on bringing medical students in or later year medical students to assist with test collection or other clinical support?
So we're continuing to have conversations with stakeholders about how that might be able to be facilitated, and those conversations are ongoing, so I don't have any further updates at this point in time. Okay, thank you.
You guys are a little bit younger than me, but how many people are nightclubbers at 9 p.m. as opposed to...
Not so much as the 4 a.m. I would want.
Yeah,
I would say, but
I just think that, I suspect that probably only the